Welcome back to Mystic Chapters. Before we begin, one thing you need to know: everyone in this room thought they already knew who held the power. They were wrong, and by the end of tonight, one of them would understand exactly how wrong. Do you know what my father's name means in this building? I know what his chart says.
Two-time state champion.
I train every single day. I heard you. I'll drop you before you even blink. Bryce Harlan had spent his life treating every room like a contest he had already won. He was a two-time state champion, the son of the man whose name was above the cardiac wing, and no nurse had ever held her ground against him. He had just told this one she would be on the floor before she blinked. What he did not consider was why she never flinched, why her hands stayed still, why she looked at him the way someone looks at a problem they solved years ago. What exactly did Bryce Harlan just walk into? If you want to find out, and trust me, you do, make sure you subscribe to Mystic Chapters so you never miss a story like this one. Now, let's go back to the beginning. The VIP wing of Northbridge Medical Center did not look like a hospital. The floors were pale marble, cool and hushed underfoot. The curtains along the corridor were cream-colored silk, and the nurse's station had been designed to resemble the reception desk of a high-end hotel. Clean-lined, soft lighting, a surface that never seemed to hold anything as ordinary as a clipboard. Patients here were not admitted so much as accommodated. The families who filled the private waiting rooms were not worried relatives so much as stakeholders. People who had learned long ago that money could purchase comfort in almost any circumstance, including illness. The staff understood the unspoken terms of working in this wing. Excellent clinical care was expected, but so was a particular kind of deference, a willingness to absorb complaints without flinching, to rephrase hard medical truths in the softest possible language, and to remember at all times that the families in those rooms had influence over the hospital's annual budget in ways that could end careers quietly and without warning. Most nurses stationed here had developed a specific skill set over the years: clinical precision wrapped in impeccable patience. The ones who couldn't manage that combination usually requested transfers within a few months. Natalie Rourke had been working the VIP wing for just under 4 months, and nobody had figured her out yet. She kept her copper-colored hair braided tight against the back of her head. She spoke in a tone that was neither warm nor cold, simply measured, as if each sentence had been considered before it was released. She did not participate in the small social rituals that bonded the other nurses during slow overnight hours. She arrived early, documented everything, and left without lingering. Her co-workers had landed on a consensus opinion without quite discussing it: she was competent, a little distant, probably going through something personal.
Nobody pressed. None of them knew.
What the hospital's HR file did not reflect, because the relevant documents were classified at a level most people at Northbridge would never encounter, was that before Natalie ever set foot in this building, she had spent 9 years in the United States Navy. She had served as a combat medic embedded with special operations units. She had reached the rank of lieutenant commander. She had led a team through situations where the margin between a correct decision and a catastrophic one could be measured in seconds, and where the people around her were counting on her not to flinch. She had been decorated for it. She had also carried it home with her in ways that decorations couldn't address. When she finally left the military, the only thing she wanted was a life that asked nothing of those particular skills. She had chosen nursing because it was familiar ground. She understood the body under stress, understood emergency response at a level most civilian practitioners never reached. But she had also chosen the VIP wing specifically because it was supposed to be quiet, controlled, a place where the most dangerous thing that happened on any given shift was a difficult family member, not a deteriorating tactical situation. She had been wrong about that, but she didn't know it yet, not on the evening that Warren Harlan's son decided she needed to be corrected. Warren Harlan was the patient in Suite 12, admitted 6 days earlier for congestive heart failure complicated by a pericardial effusion, fluid accumulating around the heart in a slow, stubborn buildup that the cardiology team was monitoring with a kind of cautious patience that reflected both good medicine and an awareness of who was paying for the room. Warren had donated the equipment in the cardiac imaging pavilion 2 floors down. His name was on the wall in raised bronze letters. The hospital's administration had made it clear, without ever stating it explicitly, that the Harlan family was to be treated with a level of consideration that went beyond the standard of care. Most of the nursing staff interpreted this as "don't argue with them." Natalie had interpreted it as "document everything carefully and do the job correctly," regardless of who is watching. Warren himself was not a difficult patient. Mid-60s, white-haired, with a kind of stillness that sometimes settles over powerful men when illness forces them to slow down. He watched things carefully. He had noticed early on that Natalie monitored his numbers differently than the other nurses, not just checking boxes on a screen, but reading the data the way someone reads a situation, looking for what the numbers were pointing toward rather than simply what they currently showed. He hadn't said anything about it directly, but he had started paying attention to when she was in the room. During one of her early evening shifts with him, Warren had mentioned, almost in passing, that he was in the middle of finalizing a significant land acquisition and that he did not want word of his hospitalization reaching certain business contacts. He said there were people who would find his absence from the negotiating table useful, people who had been waiting a long time for an opportunity like this one. Natalie noted it the way she noted everything, quietly filed away, attached to no particular expectation of relevance. She had been wrong about that too. His son was a different matter entirely. Bryce Harlan was 31 years old, built like someone who had made physical dominance a personal project, and he wore his 2 state martial arts championships the way some people wear a title, as though it preceded him into every room and entitled him to a certain amount of clearance. He had been in the hospital every day since his father's admission, and he had made his presence felt in ways that kept the nursing staff in a state of low-level tension.
He didn't shout. He didn't need to.
He had a particular way of stating requests that made them sound like reasonable expectations while simultaneously making clear that non-compliance would be treated as a personal insult to a family that had been very generous to this institution. The other nurses had learned to route around him. Natalie had not. The confrontation over the pain medication had been building for 2 days before it arrived. Bryce had decided that his father needed an additional dose of opioid analgesic, and he communicated this to Natalie with the confidence of a man who was accustomed to decisions being ratified rather than reviewed. Natalie pulled up the medication schedule without raising her voice and explained, in the same measured tone she used for everything, that the attending physician had adjusted the dosing window 6 hours earlier and that Warren was not due for another cycle until morning. This was not a judgment call.
It was the chart.
Bryce's expression moved through several phases quickly: surprise, recalibration, the particular irritation of a man who rarely encountered a sentence that didn't bend in his direction. He stepped closer, a technique Natalie recognized immediately as an attempt to reframe the conversation using physical space.
She didn't step back.
He told her she clearly didn't understand who his father was in this building. He told her that the Harlan family's contributions to Northbridge had made possible programs she was currently benefiting from just by standing in this hallway. He told her that every other person on this floor seemed to understand how things worked, and suggested that perhaps she was new enough that someone ought to explain it to her. Natalie said again that her decision was based on Warren's current medical profile and that it wasn't going to change. Then she moved to continue her rounds. Bryce followed her into the corridor, something she noted without reacting to visibly. He talked while he walked about his training regimen, about the discipline required to compete at the level he had competed at, about the fact that he had sparred with security professionals twice the size of anyone currently working this floor, and that he had won. It was the kind of monologue that was not really aimed at her, she understood. It was aimed at the air around her, an attempt to fill the space with enough noise that she would feel the pressure of it. She had been in rooms with people who projected actual danger. This was not that, but it was loud, and it was meant to be. What Bryce had not noticed, because he was talking, was that Natalie's attention had shifted entirely away from him. She was looking at the monitor display visible through the glass panel of Warren's room. The numbers had been drifting for the past 40 minutes in a direction she didn't like. Oxygen saturation was at the low end of acceptable. The neck veins, visible even from the doorway, were slightly distended. The pulse on the readout showed a narrow character, the kind of pressure differential that most nurses wouldn't flag as alarming yet, but that to someone who had watched people's circulatory systems fail under battlefield conditions registered as a specific kind of early warning. She excused herself from Bryce's monologue without ceremony and went into Warren's room. Warren was awake, watching her the way he had started watching her, with the attentiveness of a man who had noticed something he hadn't fully classified yet. She checked his pressure manually, cross-referenced it with the monitor, and spent a long moment looking at the waveform on the cardiac display. The fluid around his heart was doing what fluid did when it accumulated. Past a certain point, it began interfering with the heart's ability to fill properly. Warren asked her quietly if she had seen this kind of thing before. It was a more specific question than it sounded. She told him that real strength tended to be quieter than most people expected. She was not answering his question directly, and he knew it, and the slight adjustment in his expression told her he was filing it away. She paged Dr. Dana Walsh, who was covering the floor and managing 11 other patients simultaneously. Dr. Walsh reviewed Natalie's concern over the monitor feed remotely and told her that while the numbers were worth watching, they hadn't crossed the threshold that would warrant escalation at this hour. She wanted to proceed with the echocardiogram in the morning as already scheduled. Natalie said that by morning the window for easy intervention might have closed.
Dr.
Walsh's response was careful and not unkind, but it was clear. Natalie was a nurse. The clinical decision belonged to the physician. They would monitor through the night. Natalie accepted this. She updated her documentation precisely and returned to her other patients.
She did the work in front of her. She kept moving.
Bryce found her again near the supply corridor an hour before midnight. This time he had his phone camera facing her, and he positioned himself in the narrow space between the shelving units and the door with a deliberateness that told her this was not spontaneous. He said he wanted her to repeat what she had said earlier on the record, so the right people could hear it. He said she had embarrassed his family in front of a floor full of staff and that she needed to understand the consequences of that. Then he said the same thing he had said in the hallway, that she would be on the floor before she could react, that she was not dealing with someone who made empty statements about what he was capable of. What happened next lasted less than 3 seconds, and Bryce would not fully understand it until much later. Natalie's center of gravity dropped fractionally. Her hands came open and relaxed in a very specific way, not the open hands of someone backing down, but the open hands of someone removing a constraint from their own response time.
Her chin came down a degree. Her eyes changed.
They did not go cold exactly, but they became very narrow and very still, the way a camera lens adjusts to bring something into precise focus. It was not an aggressive posture. It was something quieter and considerably more serious than aggression. The posture of someone who had already run the scenario and was simply waiting to see which version of it Bryce intended to initiate.
Bryce stopped talking.
He didn't step back exactly, but his weight redistributed in a way that wasn't voluntary, a response from some part of him that operated below the level of his considerable self-confidence. He had trained for years to read physical cues in opponents, and what he was reading in this woman did not match anything in his experience of competitive environments. It matched something else. He didn't have a word for it. Natalie held that for a moment. Then she said evenly that she needed to check on her patient, and that he should let her pass. Bryce moved aside. He wasn't sure why he did it as quickly as he did. She walked back toward room 12 without looking back, and she understood, with the clarity of someone who has made this kind of calculation before, exactly where the night was heading. The alarm came at 4:52 in the morning. Natalie was 3 rooms down, updating documentation at the mobile workstation, when the cardiac monitor in Suite 12 sent its signal down the corridor. She was moving before the first cycle of the alert completed, not running exactly, but covering ground with the kind of efficiency that doesn't waste motion on anything unnecessary. The other nurses on the floor responded to alarms the way most people do, with a moment of assessment, a look at the board, a confirmation. Natalie had already crossed the threshold of Warren's room by the time that moment would have finished. What she found was exactly what she had been calculating toward all night. Warren's blood pressure had dropped to 70/40. His pulse was present but thin, a thready signal communicating a heart working hard against a constraint it couldn't overcome. The neck veins she had noted earlier were now visibly engorged. His lips had taken on a faint blue cast. His eyes were open and tracking her, which meant he was still present, still conscious, but the effort it was taking him to stay that way was written across his face clearly enough that no equipment was required to read it. Natalie had seen this before, not in a hospital, but in places where the nearest surgical team was a helicopter ride and 40 minutes away, and where that 40 minutes was not always available. The fluid around Warren's heart had accumulated past the point of compensation. It was pressing inward on the muscle from all sides, and the muscle, which needed space to expand, to fill, to push, was running out of room. Cardiac tamponade. The textbook description and the reality were 2 different things, but she had encountered enough of the reality to know exactly how much time was left in the window where intervention was still straightforward. Dr. Dana Walsh arrived 30 seconds behind her, having been paged from the workstation at the far end of the floor. She took in the numbers, looked at Warren, and did what good physicians sometimes do when a decision is both necessary and frightening. She looked for a reason to wait. She said she wanted to hold for the cardiology team. She said pericardiocentesis was a high-risk procedure and that performing it outside a fully equipped setting, without the appropriate specialist present, was not a decision she was authorized to make unilaterally. She said these things in the voice of someone who knew they were correct on a procedural level and was hoping the procedural level would hold. Natalie told her that if they waited for the cardiology team to assemble, Warren would not be alive when they arrived. She said it without inflection, without drama, the way she would have communicated a tactical assessment to a superior officer.
Here is the situation.
Here is the timeline. Here is what happens if we don't move. Dr. Walsh looked at the monitor again. The pressure had dropped to 60/30 while they were talking. Bryce appeared in the doorway at a run, having been in the family waiting area down the hall. He took one look at his father and started forward, and Natalie turned to him with a directness that stopped him mid-step. She told him to stand against the wall or leave the room, and she told him this in a voice that bore no resemblance to the measured, careful tone she had used during every previous interaction he had witnessed. This voice was low and absolute, the kind that does not invite negotiation because it was never designed for conversation. It was designed for situations where compliance was not optional. Bryce's body responded before his mind could argue. He pressed his back against the wall near the door and stayed there. Natalie gathered the emergency kit. She identified the subxiphoid approach by anatomy and by the bedside ultrasound. She positioned with the speed of someone who had performed this particular localization without ultrasound, in conditions considerably worse than this. Her hands were steady, not because the situation wasn't serious, but because seriousness was precisely the condition under which the training had been designed to operate. She had spent 9 years building a version of herself that did not shake when it mattered. She drew on that version now. The needle found its angle. She aspirated dark, non-pulsatile fluid, the accumulated pressure that had been strangling Warren's heart for hours, and placed a temporary drain. Within seconds, the monitor began to shift.
The pressure numbers climbed. The waveform deepened.
Warren's color, which had been retreating toward gray, began its slow return. He let out a breath that was not a breath so much as a release, the body's involuntary acknowledgement that the thing crushing it had been partially removed. Dr. Walsh stood at the foot of the bed and watched, and she did not say anything for a long moment. Bryce watched from the wall and did not say anything either. The room recalibrated. Nurses who had crowded the doorway in varying states of alarm began the process of stabilizing and documenting. The cardiology team arrived 12 minutes later and took over the immediate management with the efficiency of people who were very good at their jobs and also very clearly aware that the critical work had already been done without them. Warren was conscious, stable, and looking at Natalie with an expression that had moved entirely past gratitude into something more complicated. The look of a man who has just been shown something he did not expect and is actively revising his understanding of the world. The summons to Dr. Claudia Renner's office came 2 hours later. Dr. Renner was the chief medical officer of Northbridge, and her office reflected the position, measured, orderly, designed to communicate authority through restraint rather than display. She had a file on her desk that Natalie recognized as her own personnel record, and she had the specific expression of an administrator who has just been handed a situation that is simultaneously a liability problem and a human story, and who is experienced enough to know those two things require very different responses. She acknowledged first that Warren Harlan was alive because of what Natalie had done. She said it plainly, without qualification. Then she said, equally plainly, that what Natalie had done fell outside the documented scope of practice for a registered nurse at this institution, and that the hospital's legal exposure as a result of that gap was not a small problem. She needed to understand who Natalie was, and where the training that had produced tonight's outcome had actually come from. Natalie said she had received advanced trauma training. She said she was not able to go into specifics. Dr. Renner held her gaze for a moment and then said that was not going to be sufficient given the circumstances. Bryce was in the room as well, seated in a chair near the window, and he had not yet said anything. He had the look of someone running a calculation that kept producing a result he didn't fully trust. The woman sitting across from Dr. Renner was the same woman he had cornered in a supply corridor less than 6 hours ago. The same woman he had told on camera, with the confidence of someone who had never been wrong about physical assessments, that he could put her on the floor before she blinked. He had watched her perform a procedure that the arriving cardiologists had examined with visible respect. He was having difficulty making these two images occupy the same frame. Dr. Renner's desk phone rang. She answered it with the practiced efficiency of someone who fields important calls frequently. Then her expression changed in a way that was subtle but unmistakable, the micro-adjustment of a person who has just understood that the conversation they are having is not the one they thought they were having. She said, "Yes, she's here," and extended the receiver toward Natalie. The voice on the line identified itself as Rear Admiral Thomas Baird. He asked to speak with Lieutenant Commander Rourke, using the rank without preamble, and the use of it in this room in this context was not a small thing. Natalie took the phone. The conversation was brief. When she set the receiver down, the room had rearranged itself around a new set of facts. Rear Admiral Baird had told Dr. Renner's office, before being transferred, that Natalie had served 9 years in the United States Navy, that her work had been attached to special operations units at a level that precluded most of her service record from being disclosed through standard channels, and that she had been decorated multiple times for actions performed under conditions that most people who worked in hospitals would find difficult to conceptualize. He had also said that he would very much like her to return to active service, and that he was calling in part because the events of tonight had made it clear to him that her skills were not diminishing in a civilian setting. Natalie told Dr. Renner and Bryce what she was able to tell them. She had worked as a combat medic. She had performed procedures in the field that civilian medicine reserved for specialists, because in the field there were no specialists. There was the team, the casualty, and whoever had the training to bridge the distance between those two things. She had made those decisions under conditions where hesitation was its own kind of choice, and she had learned to live with the weight of both the decisions she had made and the ones she hadn't. Bryce did not speak, but the quality of his silence was different from any silence she had seen from him before. It was not the silence of someone suppressing a response. It was the silence of someone whose internal architecture was being quietly reconstructed. The meeting concluded without resolution. Dr. Renner needed time to consult with the board and with legal, and Natalie understood that her position at Northbridge was now genuinely uncertain. She walked back toward the VIP floor with a specific awareness of someone who has revealed a card they spent months keeping face down, and who cannot now unreveal it. She was outside Warren's recovery room when the security officer intercepted her. A man had entered the room approximately 8 minutes earlier. He had identified himself at the floor desk as a relative of another patient on the wing. His name was not on the visitor registry. He had declined to leave when asked. He was currently standing near Warren's bedside. Natalie entered the room ahead of the security officer. The man was in his early 40s, wearing a dark jacket that fit in a way designed to look casual and did not quite succeed. His name, she would learn later, was Cole Riek, a private security contractor with a professional history connected, through several intermediary arrangements, to a man named Gerald Kessler. Kessler and Warren Harlan had been adversaries in a commercial real estate dispute years earlier, a negotiation Warren had won decisively and Kessler had not forgotten. Warren had mentioned, during an early shift, that there were people who would find his hospitalization useful. She had noted it then. She needed it now. She did not know Cole's name or his connection yet, standing in the doorway. What she knew was what his body was telling her, which was considerably more information than he intended to provide. His weight was distributed forward, toward the balls of his feet, not the weight distribution of someone visiting a sick person, but of someone prepared to move quickly in a specific direction. His right hand stayed consistently close to his hip, never hanging naturally the way a relaxed hand does. His eyes had already mapped the room. She could see it in the way he didn't look at the door when she entered, the way his gaze moved to the window and back with the practiced non-reaction of someone who had registered her arrival before she fully crossed the threshold. He had assessed this room before entering it. He knew where the exits were. He was not here to see a patient. What he was watching, what his position in the room had been incrementally orienting toward, was the 4-line running from the medication port into Warren's arm. Natalie told him to step away from the bed. Cole looked at her with the specific expression of a man who has been underestimated so reliably that he has stopped preparing for other possibilities. He said this had nothing to do with her.
He said she should leave.
His right hand drifted another inch toward his hip. Natalie did not look at his face.
She watched his hands.
The moment Cole's weight committed, the instant his body resolved the decision it had been building toward, she understood that whatever remained of the quiet life she had been constructing at Northbridge Medical Center was no longer available to her. There was the 4-line, and there was Warren, and there was the distance between Cole and both of those things, and there was her. The math was not complicated. It was just final. She moved. She caught Cole's wrist 2 inches from the foreport. The intercept was not a dramatic thing to watch, which was part of what made it so unsettling for the people in the room. There was no warning gesture, no verbal escalation, no telegraphed preparation. One moment Cole was committed to his forward motion, and the next Natalie had his wrist redirected, using the momentum of his own lunge to steer him away from the bed and into the metal rail of the bed frame. The rotation she applied to his joint was precise, enough force to compromise his balance and his options simultaneously, not enough to cause structural damage.
His knees bent.
She guided his arm behind his back and positioned her forearm across the base of his neck with the kind of calibrated pressure that communicated, without ambiguity, that she had access to a great deal more force than she was currently applying, and had made a deliberate choice not to use it. The entire sequence took 4 seconds. Cole had stopped moving by the third. Natalie told him, in a voice so level it was almost conversational, that he should not reach toward his jacket. She told him she had identified the outline of what he was carrying before she crossed the room, and that if he moved his hand in that direction, she would treat it as a decision and respond accordingly. Cole's breathing was audible and effortful. He did not move his hand. Natalie looked toward the door and told the security officer who had followed her in to contact hospital security and call the police, and to tell them that the individual in custody appeared to have entered the VIP wing with intent to interfere with a post-surgical patient's medical equipment, and that a potential weapon was present on his person. She delivered this information in the same tone she might use to relay a set of vitals, organized, sequential, without effect. The security officer, who had spent his career managing situations that topped out at disgruntled visitors and parking disputes, moved very quickly to comply. Bryce was in the hallway when it happened. He had followed at a distance after the security officer intercepted Natalie. Some combination of protectiveness toward his father and an instinct he couldn't have articulated pushing him toward the room. He stood in the doorway for the full 4 seconds, and then for the 30 seconds after that, watching Natalie hold a man who was clearly trained for physical resistance, without visible effort, without apparent strain, the way someone holds a position they have held many times before, in contexts that required it to actually work. He had told her less than 7 hours ago that he could put her on the floor before she blinked. He had said it on camera. He had said it with complete sincerity, because at that point he had no information that would have suggested it was not true. He understood now, standing in the doorway of his father's hospital room, that he had been operating with a nearly total absence of relevant information, and that the gap between what he had assumed and what was actually true was large enough that he found it difficult to look at directly. But the thing that settled heaviest on him, heavier than the embarrassment, heavier than the simple fact of being wrong, was the recognition that Natalie had known, during that hallway confrontation, exactly what she was dealing with. She had made an assessment in under a second and concluded that the correct response was to stand still and give him a way out. She had chosen restraint not because she lacked options, but because she had more options than he could count, and had decided none of them needed to be used on him. That was not weakness. That was something else entirely, and Bryce did not yet have a word for it, but he felt its weight. Cole Riek was in police custody within 20 minutes. The weapon found inside his jacket, a compact device designed to inject a concentrated substance into an 4-line without leaving visible external evidence, confirmed what the circumstances had already suggested. Warren Harlan had been protected twice in the same night, by the same person, using 2 completely different sets of skills that most people never would have guessed existed in the same individual. Warren was told the full account 2 days later, when he was alert enough to absorb it properly. He was sitting up in bed, the color returned to his face, a sharpness back in his eyes that had been absent during the worst of his illness, when Natalie came in for the morning assessment. He told her that Dr. Renner had spoken with the board, and that the board was discussing her situation, and that the phrase they were using was scope of practice deviation. He told her this directly, without cushioning, because he had concluded she was someone who preferred accurate information to comfortable versions of it. Then he told her that he had spoken to the board himself, and that he had informed them that if the hospital chose to terminate the employment of the woman who had saved his life twice in the span of a single night, he would withdraw the funding that currently supported the Harlan Cardiac Pavilion, effective immediately. Natalie told him he didn't need to do that. Warren said she was correct, that he didn't need to, and that the distinction between needing to do something and choosing to do it because it was right was precisely the point. He had spent decades doing things because they were strategically necessary. He had decided he preferred, at this stage of his life, to do them because they were correct. The Navy's contribution to the board's deliberation arrived in the form of a partially declassified service summary, delivered through official channels to Dr. Renner's office. The document confirmed 9 years of active service, confirmed the specialized nature of Natalie's operational role, listed a series of commendations without specifying the actions that had produced them, and noted, in language that was both bureaucratic and quietly remarkable, that she had led a successful extraction of 11 personnel from a high-risk operational environment under conditions classified above the level of the summary. The board read it. Dr. Dana Walsh provided a clinical statement describing exactly what the cardiac monitor data had shown and exactly what would have happened to Warren Harlan if the intervention had been delayed until specialist arrival. The security footage showed the interaction with Cole Riek in full, including the 4-second containment and the disciplined restraint that followed. The board voted not to terminate. But she had left it for reasons that had not changed, and those reasons still held. What she was doing now was something different. She was stopping the pretense that the person she had been and the person she was trying to become were two separate identities requiring careful management. They were the same person. They had always been. Bryce found her in the corridor outside the new training room, a repurposed conference space on the second floor, on the afternoon before the first scheduled session. He was not wearing his championship jacket. He had on a plain gray shirt and the expression of someone who had spent several days having an uncomfortable conversation with themselves and had arrived finally at something honest. He said he had been wrong. He said it without preamble and without the kind of performative humility that is really just pride wearing a different outfit. He had walked into that hospital assuming his physical capability was the most significant thing about him, and he had treated people accordingly, and he had been wrong. He had confused the ability to win a controlled competition with some kind of broader authority over situations and people that he had never actually earned. Then Bryce asked if she would train him, not to fight, he clarified. He had enough of that. What he wanted to understand was what she had done in that room. They learned anyway, because Natalie taught the way she did everything, without performance, without ego, with complete attention to what the person in front of her actually needed to understand. Warren attended the third session. He was still in the final stages of his recovery, and a member of the nursing staff had helped him down to the second floor in a wheelchair at his own request. He positioned himself near the door and sat quietly watching. His son was at the far end of the room with a notebook, asking questions and waiting his turn to speak like everyone else. Warren observed this with the specific attention of a man cataloging something he recognized as valuable. He had built a great deal in his life: a wing of a hospital, a real estate portfolio, a family name, raised bronze letters on 2 floors of a major medical institution. What he was watching right now was not something he had built, and he understood with some clarity that it was the most significant thing in the room. Laurel Grant caught Natalie after the session. Laurel, 10 years her senior, had been quietly keeping an eye on the new nurse since her first week, with the patient attentiveness of someone who recognizes competence that is trying not to be noticed. She said, with the gentle directness of a woman who has earned the right to speak plainly, that Natalie could have mentioned the Navy thing at any point during the past 4 months, and that Laurel's feelings about the omission were complicated but ultimately forgiving. Natalie smiled and said that concealment had become a very old habit. Laurel asked if she was staying, genuinely staying this time, not constructing an exit while the room wasn't looking. Natalie looked down the corridor. Bryce was helping an orderly ResTac equipment carts without being asked, doing it without ceremony, without looking around to see if anyone was noticing. Warren was speaking to one of the nurses who had been in the room the night of the tamponade, and whatever he was saying was making her laugh. The staff, who had spent 4 months politely ignoring the quiet nurse with the braided hair, were now looking at her differently, not with awe exactly, but with the particular regard people extend to someone they have correctly identified as worth knowing. She told Laurel she was staying. The uniform had changed. The mission she had discovered was the same one. It had always been. She had just finally stopped pretending she could do it as someone else. Real strength doesn't need an audience. It doesn't announce itself with titles, trophies, or threats. It shows up in steady hands when a life is slipping away, in a voice that doesn't need to rise to be heard, and in the courage to act correctly when no one is standing beside you. If this story reminded you of someone like that in your life, or of something in yourself worth remembering, share it with someone who needs to hear it today. And if you haven't subscribed to Mystic Chapters yet, now is a good time. There are more stories like this one waiting, about the quiet people who show up and change everything.